What are some of the biggest myths and misconceptions out there when it comes to probiotics? I mean, there's so many different competing claims. We have everything from, the typical old school acidophilus supplements to spore and soil-based probiotics, to what else? The lactobacillus species, bifidobacillus species, and prebiotics, postbiotics. The whole thing has become kind of complex. There's also the yeast species, Saccharomyces boulardii, and like, where does one begin in the realm of probiotics? And maybe speak to a few different myths, common myths and misconceptions that are out there.
Okay, yeah, I could talk about that. We have one of the biggest myths that I love to talk about is the refrigeration aspect of it. So many people, doctors are finally starting to talk about probiotics, which gets us so excited. But then they'll say to their patients, "Oh, make sure you get one in the refrigerated section." And so we always say, like, how could that possibly make sense? Because if a probiotic needs to be refrigerated in order to stay alive, it means it can't even withstand the room temperature of the store shelf. So how in the world would it survive your body temperature, which is 98.6, much less the harsh conditions of your gut, stomach, which is very acidic and meant to be a gastric barrier. So, and the answer is most of them aren't. I mean, the majority of probiotics, we've done many, many studies on this showing that the majority of probiotics on the market that are made up of lactobacillus and bifidobacterium are dying before they ever get to the intestines. So that would probably be one of the biggest myths that we see out there. And then it kind of going hand in hand is the myth that more is better. You see the probiotics that have 50 billion CFUs, some with 250 million CFUs, and it just keeps going higher and higher and higher. And really, there's no science behind that. There's no science at all. And the reason a lot of these companies are doing that is, a lot of it is, of course, is branding and marketing and just trying to say more is better. But a lot of it is just that because they know most aren't even surviving. Most aren't even getting there alive. And even if they did get there alive, they're not really making a change in the gut flora. So those are some of the biggest myths that I see is it doesn't need to be refrigerated in order to be a high quality probiotic. And really the amount of CFUs that are in the product, really, there's no studies saying more is better. Really what we need to focus on is what are the CFUs that are in there? What are they doing to the gut? What kind of change are they doing in the gut? And the strains that are found in Just Thrive, the bacillus spores, we actually have a study that after 2.5 weeks showed a 30% favorable shift in the gut flora. So that's really profound to see that type of a shift in just 2.5 weeks.
Mm-hmm. There's a lot in there, and I want to come back to this point about what are the different species doing when they get in there. To the point of living versus non-living, I think there's another interesting layer to that story, which is that there's some research that seems to have come out in recent years suggesting that some species of bacteria, even if they're dead, seem to have a beneficial effect either on gut health or, for example, immune health. And I think connecting to the gut immune stuff that Kiran was just speaking to. But can you talk a bit about how even dead bacteria coming in through the oral route can help benefit microbiome health or benefit the gut immune crosstalk?
Yeah. So in general, getting, like we talked about before, in general, getting exposure to bacteria is a beneficial thing. Now, the idea of dead bacteria causing a response in the body is actually quite well established. It actually creates something called a probiotic paradox, right? And the probiotic paradox in the research world is that the scientific definition of a probiotic is a live microorganism when added at adequate amounts confers a health benefit to the host. So that live part is really important to be a quote unquote probiotic. Now, there are some bacteria which are sold as probiotics that actually, when they're dead, will have actually, in some cases, a more profound impact than the live version, right? And the way they kill them is they heat kill the strain, and then you put it into the system, and you get a similar effect as a live strain. In fact, in some cases, better effect. A great example of that is Rhamnosus GG, a very well-known strain of lactobacillus. Numerous studies have shown a dead Rhamnosus GG works better than the live version. So then that creates a whole new category of bacterial therapy where these are not probiotics because they don't fit the scientific accepted scientific definition of probiotics. These are what we call metabolic response modifiers. So they have very specific components within them, whether it's a cell wall component, some of their DNA or RNA, or even these little nanoparticles that microbes can make inside of them. They're these nanovesicles. When those are released, they actually have impact on our metabolic response. So, but here's a limitation of those, which is also important to note. Number one, those are very subspecies specific, right? So the rhamnosus GG effects that we see, you don't see the same effect in wild type regular rhamnosus. It's this really special GG variant. That's the same thing with Acidophilus DDS1 or Infantis 35624. In order to get those benefits, you need that very specific subtype. And what we have as a major problem in the probiotic industry is companies will say, we'll use the rhamnosus GG research to promote their product that has generic rhamnosus in it, right? Because the generic rhamnosus costs nothing to buy out of China or anywhere else. And the rhamnosus GG is a high level strain. It costs more. It comes with licensing things and all of that. So they just go, they use this borrowed science on their generic stuff, and it does not translate. So that's one really big egregious thing, is that there is science behind some of these dead bacteria, but it has to be that specific subtype, right? So then that's one thing. The second thing is the metabolic response does go away over time, because like any other nutrient, it's triggering a metabolic response. It can fade or it can change because it's not making an actual change to the microbiome. So our whole focus has been, if we really want to see profound change in people and lasting change, we have to focus on changing the microbiome itself, right? So we're talking about things going in at 10, 20, 100 billion even, which sounds like big numbers, but remember, it's going into a sea with 40 trillion organisms, right? And unless you can influence the change within the other 40 trillion, that tiny minuscule drop you're putting in doesn't really create a profound effect. So our focus has been, what are the things that occur that you can do or stop doing that actually changes that sea of organisms? Because that's where the profound effect is.
Gotcha. Okay, I think there's one more layer here, I think that's of importance, at least in my mind, which is colonizers versus non-colonizers. And part of that is what you just addressed there. But there's some species even that reach the gut still alive and maybe don't colonize. They kind of have a transient effect. And then unless you keep taking them every day, you know, the effect leaves relatively quickly. And then there are other species that you can take as probiotics that colonize and have some sort of lasting effects there, and maybe also interact in profound ways with the other microbes in that system, which I believe you were getting at, Tina, when you were referring to the study that showed a 30% improvement in gut flora as a result of using this probiotic. So talk to me about non-colonization versus colonizing species.
Yeah. Well, the spores actually, they do colonize, but then they eventually do leave the body. So they stay there for about 21 to 28 days, where they go to work through every part of the intestinal tract, from the small intestine all the way down to the distal colon. And then they will eventually leave the body after 21 to 28 days. So it's, they're pretty unique in that they could actually do both. They're colonizing, and then they are actually transient too.
Yeah, and to expand on that, one of the things that people tend to mistake is they think colonization is permanent, right? Or there's a time component to colonization. Colonization can be very temporary, meaning, and colonization is really the act of a single cell embedding itself and then forming a colony. And a colony is actually, hundreds of thousands of cells in one little lump, right? Each colony represents the progeny of a single cell that established itself. So there's no time factor in it. You can colonize for a day and then detach and leave. It's still colonization. But like you said, there are strains that actually just move right through. Now, some of those will actually produce metabolites as they're moving through, or will induce the production of metabolites as they're moving through. Boulardii kind of fits in that world. That's Saccharomyces boulardii, the yeast. It's not a great colonizer, meaning it doesn't necessarily go in and live in the gut for any period of time. But as it's moving through, it actually has really profound immunostimulatory effects. And then in some cases, they've also shown that it does produce acid as it's moving through, which actually gives it a really interesting effect in modulating the ecosystem that is then beneficial for lots of good microbes, right? In general sense, you can think of egregious type of microbes or egregious type of fungi don't do well in low pH environments. They prefer the pH to be elevated. So anytime you can bring down the pH in the gut, you're really kind of helping the good guys flourish.
Gotcha. Okay, so something like, let's just compare as a practical example, I don't know, lactobacillus species or acidophilus or something like that versus the bacillus species, the spore-based probiotics that you guys have in Just Thrive. How do they behave differently in the gut?
Yeah, so let's assume, so for the most part, when you take a lactobacillus species as a probiotic, most of it is going to die in the stomach. They're not really designed as robust organisms that can survive the gastric system, right? So now the death of them, if you're taking the right species like Lactobacillus rhamnosus GG or Acidophilus, if those species are in the mix that you're taking, then they will have a metabolic response in your body that could be favorable. In the case of rhamnosus, it can do things like shorten the duration of colds and flus because there are components of it that stimulate the immune system in the right way. In the case of Infantis 35624, it actually shortens the duration of diarrhea in kids. So it has those impacts. You're just the most generic of probiotics. Let's say you just go to a big box store and you buy one that has 50 billion CFUs of a bunch of lacto and bifido. Most of what's happening there is they're dying in the stomach. The components of those bacteria are moving through the system. In some cases, they will help trigger some immune proliferation. So it could be training for your immune system. But in some cases, the DNA within those species may be problematic, right? Because the genetic pool in the microbiome is really important because that's where a lot of functionality is derived. And so if you're loading your gut with the same genetics from the same 10 species, and they're at 100, 200 billion at a time, you could be introducing kind of an unnatural denominator into the genetic pool. And so that is the part that scares me a little bit about those, what I call kitchen sink formulas, right? That have 15, 20 random strains and really high doses. Because there isn't a natural version of that happening in the body, right? We don't walk around in the natural environment and pick up 100 billion bifido or lacto and take it in between meals and so on. So that's the part that makes me nervous about those kind of products and why I don't use them, why I never recommend people to use them. But, like I have rhamnosus GG as an example in my cabinet for, cold and flu season. If my kids start getting sniffly, they get the spores and then they get that because it's been shown to be useful for that function. So that's the difference. Now, the spores, when they go in, they colonize in different parts of the gut. They do start the colonization in the small intestine. They will also move down into the large intestine. During their colonization, they are actually modulating the rest of the microbiome. Like Tina mentioned, one of our studies showed almost a 30% increase in diversity in the rest of the microbiome when you introduce the spores in. Right. And then they're competing against the overgrown and dysfunctional bacteria. They're producing short chain fatty acids. They're tightening up the tight junctions by producing stimuli that close up the tight junctions in the gut. So they're doing all of this.
Those really are just for people who don't know, the tight junctions are the critical factor when it comes to gut permeability to leaky gut.
Exactly. Yeah, exactly. That's to leaky gut. And then they're increasing the growth of keystone strains, which is the part that was really exciting to us because these keystone strains in your gut are these relatively dominant strains in terms of volume that are inversely correlated with numerous chronic illnesses. Right. So being able to get those keystone strains up becomes really protective in overall health. So there's a significant difference there in what's going on when you take these different products.
So in the context of obesity, they've looked at microbiome differences, and they've most of that research has really focused on Bacteroidetes and Vermicules. Yeah. So are the Just Thrive probiotics, the spore-based probiotics, have they been shown to alter those keystone species? Is that what you're referring to, or different species?
So more specifically, species within the Bacteroidetes category, which is, so Bacteroidetes and Firmicutes are phylum of bacteria, right? So that's one of the biggest groups that you could find in terms of when you're looking at grouping bacteria all the way down to the species level. So saying Bacteroidetes is more like saying, canines, or actually to beyond canines, and there's lots of different canines within that group, right? So those are the two biggest phylum in the microbiome. You've got Bacteroidetes and Firmicutes make up almost 95% of all the microbes. So they have hundreds and hundreds of species within those groups. Now, where that research is kind of changing a little bit is that the early research on Bacteroidetes and Firmicutes were really had sequencing technology that was really good at identifying the difference between the phyla. But then when you go deeper into it, you find out that there are Firmicutes bacteria that are actually really important for metabolic health, and then Bacteroidetes bacteria that can be detrimental to metabolic health. So then they have to go deeper and go, okay, which Firmicutes and which Bacteroidetes, right? So now our understanding is there are certain microbes down to the species level or down to the genus level that are especially important for obesity. So one of them in particular is Akkermansia muciniphila. And Akkermansia is absolutely a keystone strain. It's in fact the only species within the Akkermansia genus that exists in the gut in general, and it's inversely correlated with everything in the metabolic syndrome spectrum. So diabetes, heart disease, obesity, polycystic ovarian, all of these things, dementia, all of those things are inversely correlated with the amount of Akkermansia you have. The other group is bifidobacteria, especially certain groups of bifidobacteria like Bifidobacteria longum and adolescentes are especially predominant in people who tend to be lean and have healthy body mass and metabolic response. So now getting down to that level, what you can see now is when you adjust those few species, that makes a huge, profound effect on metabolic health and obesity. In fact, we have a study that's publishing on that. What we did is we took individuals that were obese. So these are people with a BMI of 30. So they're not morbidly obese, they're not super overweight, but they were obese. And what we did is we had this hypothesis that if we can just make tweaks within their microbiome, they would start to lose weight even though they don't change their behavior. Right. So we gave them, and this was placebo controlled. So we gave them a probiotic, which is the spores, and we gave them a prebiotic, which is a xylo-oligosaccharide, which is one of those specialized prebiotics that feed Akkermansia, help feed bifidobacteria. And what we wanted to see was over a 90-day period without them changing any behavior, meaning they're not adding exercise, they're not dieting in any way, they're still eating Cheetos and all the fast food. Can we see an impact on metabolic health? And sure enough, in that 90-day period, we saw a 38% reduction in visceral fat mass.
Wow.
Without any lifestyle changes, right?
38?
38%, right?
How long of a period?
In 90 days, so 3 months.
Wow,
right?
that's
3 months.
Pretty
And that's visceral fat, right? So that's the most important fat around the trunk area, and that was done through DEXA analysis. So we're not, we're not doing the handheld things and all. This was full dual X-ray system.
This is from your prebiotic, correct?
No, this is the probiotic and prebiotic, so the combination.
Okay, got it.
The combination of both. And so the other things that we saw was sugar metabolism. So indicators of improved glucose control, glucose metabolism, and insulin response. We also saw a reduction in inflammatory cytokines. And in some individuals, we didn't have a large enough group to see this significantly, but in some individuals, we saw an increase in lean body mass, which is really fascinating because they're not exercising, right? So why is their lean body mass, their lean muscle increasing? And then that goes back to that like microbiome muscle axis, right? There's a benefit to the microbiome for you to have more muscle, more lean body mass. And maybe part of the reason why, if you look at pictures and recreations of most of our ancestors, they were all pretty ripped and lean for the most part, right? When they're walking around and they're not doing exercise the way we think of exercise. So
recently I saw a couple studies related to specific species of bacteria in the gut and endurance performance, linking it with performance in endurance athletics, which is interesting. And only makes sense, of course, that it might also modulate strength, might also modulate lean mass and protein synthesis and things of that nature.
Absolutely. And that may be one of the fundamental differences in different races of people, right? In different parts of the world. You have people in different parts of the world that have more natural physical and athletic ability versus people in other parts of the world. And some of that may be environmental factors based on the microbes that they tend to have predominate in their system.
Interesting. A quick question on the study showing decreased visceral fat mass. Was there any fat loss in the placebo group?
No, not at all. There was no fat loss at all in the placebo group. And in fact, if I'm not mistaken, I think there was a slight increase in the placebo group.
Well, I'm just blown away that you got that magnitude of effect size with no lifestyle change. Just
zero lifestyle change, right? And that was completely surprising to us as well. We assumed we would see some reduction. That was the hope. But that much reduction really speaks to the connection between dysbiosis in the gut, the liver dysfunction, the inflammation that occurs, and then the deposition of fat and the swelling of adipocytes in the truncal area. So that's why truncal obesity is so much more correlated with disease and health dysfunction than subcutaneous fat, right? Because the truncal obesity comes about as a result of dysbiosis, and the same dysbiosis that causes chronic low-grade inflammation.
Mm-hmm.
So it's all connected. The truncal obesity is just a symptom of it.
Let's talk about probiotics. This is a huge area of passion for you and something you know a ton about, and I've already learned a ton from you on this topic. Things that I didn't know. For example, the importance of strain specificity. I was kind of blown away by a lot of the research you presented on that topic, which is something I've historically kind of brushed off as unimportant. I thought it was mostly sort of a marketing gimmick that people say, oh, this strain of Lactobacillus rhamnosus versus that strain. I'm like, they're the same species. How different could they possibly be? And I've seen from a lot of research that you've presented, they are very different in many cases. So first of all, can you talk about what a probiotic actually means? And then I want to talk a bit about some common probiotic myths and then the strain specificity.
Yeah, so most of us have a vague idea what probiotics are, like beneficial microbes. But I think the strict definition is live microbes that, when administered in adequate amounts, and confer a health benefit. Yeah, and I think you could see that as having a few different components of that definition. Is one, they've got to be alive. So if you're having a supplement that contains dead bacteria, and it can still be very healthful, but it won't be a probiotic at that point. In fact, it should be termed a postbiotic, technically speaking. The other aspect is that it confers a health benefit too. And there's certain parts of the world and certain research scientists in this field who take that very seriously. Whereas if you have a strain of Lactobacillus acidophilus or Lactobacillus rhamnosus that has no research on it at all, they wouldn't call it a probiotic. They'd be like, okay, that's a bacterial strain that may or may not have any sort of therapeutic benefit. So I think that's the other interesting aspect of that definition as well as adequate amounts. And this is where this does differ a bit per strain, and that there's some pretty amazing research on Lactobacillus reuteri strain DSM-17938, which is sold around the world as BioGaia. Okay, and it's often, the research studies often use 100 million CFU, so colony forming units, so 100 million microbes. Yeah, and it gets these great results, and it's just not good for everything, but it's good for a lot of different things. For viral gastroenteritis, preventing antibiotic-associated side effects, even prevention of SIBO in people who take proton pump inhibitors. So a decent spread of applications, all at that very tiny dose. Where some people would go, there's nowhere near enough. We have to give 100 billion on 10 different strains to get any sort of impact. And it's like clearly not the case from research. And I think that's one of the probably flow into this particular myth that sometimes there's a mythology that we have to give mega doses, or it has to be mega, high potency multi-strain to get any sort of positive impact. And that's clearly not the case. And then we've got, hundreds of research studies showing single strains, even at, relatively low potencies of 100 million or 1 billion microbes having therapeutic effects clearly in the literature.
Very, very interesting. Okay. So, As far as strain specificity, can you give a few examples of how that plays out in some specific studies about specific species of bacteria for specific outcomes?
Yeah, and this is an area like when I did my training, I trained at my naturopathic training was in the late 90s, and we didn't cover strains really at all. It was kind of like very superficially, and most of the stuff was talking about species. And it's only when I started delving into it, part of my PhD, was like, you become familiar with these new concepts of, I delved into prebiotics, which I really knew superficially, delved into probiotics, and it's like, oh my God, there's actually dramatic differences in terms of characteristics or qualities, never mind therapeutic actions of strains within the same species. And for those people who are less familiar with the concept of strain, I think a good analogy here is like breeds of dog. All dogs are Canis familiaris. They all have certain traits in common, but there are differences, but they're all the same species. Yeah, and with bacteria strains within the same species, we don't have the same physical characteristics that look different, but we know that we can subject them to different exposures and they will react differently. Like they can, some strains within a certain species will tolerate stomach acid and some won't. Some will tolerate bile, some won't. Some will attach to your gut, some won't. Some will stay in your gut for a few days, some will pass straight through. Just to name a few of those sort of basic characteristics that we're often looking for with probiotics, and that we've known for a long time. You can go back to research in the 1970s that we're looking at. Let's isolate 15 strains of Lactobacillus acidophilus and let's expose them to stomach acid. And you could see even then that some strains could tolerate those things, some things did not. I think there was a study in 2010 where they took, I think it was 90 strains of Lactobacillus, I think from memory it was fermentum. And they said, okay, let's expose these 90 strains to stomach acid, let's expose them to bile, and let's see how many tolerate both those things well. And I think it was, from memory, it was 4% of those starting materials could actually tolerate stomach acid and bile to the point that they could theoretically survive transit to the upper gut. The rest would have all died. Yeah, I think that's one of those clear examples. And there's, looking at another species, Lactobacillus reuteri, and there's certain strains of Lactobacillus reuteri that can produce an antimicrobial compound called reuterin. And reuterin is effective against fungal pathogens, is effective against bacterial pathogens. But we can't assume that all strains produce it, because they don't. Only some strains do. Even if it has the name Lactobacillus reuteri, it does not mean it produces reuterin. And those strains that do not produce reuterin are very unlikely to have the same kind of benefits from a microbiome alteration perspective, either against fungal dysbiosis or bacterial dysbiosis, as those that produce reuterin. And the strain that we know that's probably the biggest from the research base is the one I mentioned before, the DSM 17938, which is in BioGaia, which has got this cool study where they gave it to essentially kids who were taking a proton pump inhibitor, which is a class of medications that probably many of your listeners are familiar with. And gosh, a lot of people take in Western nations, it's huge, but because it suppresses stomach acid output. So it's used to treat reflux disease, essentially, and also peptic ulcer disease, but that's usually a shorter period of time. But for a high proportion of people who take this medication, they develop SIBO, small intestinal bacterial overgrowth. And there's some debate about how much that is, whether it's 50, 60, 70% of these people will develop it, but it's pretty marked anyway. So this study was okay, well, what happens if we give a probiotic alongside the proton pump inhibitor? Will it prevent SIBO from developing? And this is what the study did. They gave a placebo, they gave this particular strain of Lactobacillus reuteri, and I think SIBO developed in 56% of those in placebo group versus 6% of those in that probiotic group. And I think what's interesting here is that there's another study using a combination of two different probiotic strains at maybe 10 or 20 times the dose. Similar model, let's give it to people taking proton pump inhibitors. It did not work. It didn't actually stop SIBO from developing. So it's not something that all probiotics do, but this particular strain we know produces reuterin, and reuterin works against fungal and bacterial pathogens and prevented the overgrowth from occurring, which I think is, one of the things that's pretty amazing, and means we just have to make sure that the strains that we're choosing for attacks has got the qualities and actions that we're after. One of the few studies that actually directly compared two different strains in the same study was for viral gastroenteritis, which is something that all kids end up getting, all of us will often get it from our kids, is when they bring it home from daycare. So it's immensely common, this condition, generally short-lived, but it can result in hospitalizations and dehydration and death in kids, and often does still even in Western nations because of the dehydration aspect, even though it's not, directly causes death, it's more indirectly via dehydration. So having treatments that shorten the duration and decrease the severity are extremely welcome. So in this particular study, they compared these two probiotic strains, same species, lactose rhamnosus, one with L. rhamnosus GG, one with lactose rhamnosus lactophilus. Gave these kids either of the two, and the kids that took the LGG, they got better 24 hours sooner. And 24 hours is big. If you've got a kid that's got vomiting and diarrhea, you will notice 24 hours less of vomiting and diarrhea. Yeah, and it also enhanced secretory IgA production. One of the main sort of immune markers, way that your immune system is dealing with pathogens like viruses in the gut, whereas the other lactophilus rhamnosus did not. So, and this is, again, same species, just different strains. And there's a lot more examples in terms of other characteristics that we could go into as well. But I think it is very clear if you look at the literature. It's definitely not a marketing thing. And I hear you, because I think there's a lot of practitioners. And I think this is partly because industry promotes that idea. Some in industry do. Generally, the companies that are
using
promoting supplements that don't have research. Yeah, that's right. They don't list their strains, or they use strains with no research base. So they don't want people to know about the strain specificity. They want to cloud the waters, and they do that effectively. Yeah, and this is something that I've been trying to bust for seriously 20 years. I've been trying to let practitioners, clinicians, and the general public, but mostly I work with training clinicians, this information so that they can really see through the cloudiness that's being put out there. Because the research is clear if you look at it, that there are generally big differences. Now, for certain conditions, it may not matter so much, where maybe the similarities of like their capacity of bifidobacteria strains to produce acetate, and that all of them probably will share within a given species, although there will still be differences in terms of how much they produce to certain food substrates, but they all produce acetate, for example. That might mean for certain conditions, it won't matter as much. And you might put, maybe post antibiotics, trying to restore a bit of gut health, something, maybe it won't matter quite as much, in that case, because maybe just a change in pH is all that's required to help in that case. Now, that said, it matters heaps when we're actually giving it alongside the antibiotics, where we know that certain probiotics make no difference. Like there's this cool study that was published in the Lancet, it's huge medical journal, in terms of reach and how high it is from an impact factor perspective. That used, I think it was 60 billion CFU of 4 different probiotic strains to try to prevent antibiotic-associated diarrhea. And I think it had like over 1,000 patients. It was like a big study. Did not work. Yet we've got other strains where you can give, I'll go back to that lactose reuteri DSM 17938, 200 million CFU. It works to prevent antibiotic-associated diarrhea. So we know alongside antibiotic, strains definitely do matter, but there will be some applications where I think, probably after antibiotics, where we're just trying to change the pH of the environment to help indigenous populations that we want to support to grow back a bit more quickly, may not matter quite as much.
Mm-hmm. Got it. Okay, so the big picture summary of this is strain specificity, not just marketing gimmick, often matters in a massive way and can be the difference between something working exceptionally well versus not working at all, even within the same species. Sort of like a Doberman and a Chihuahua are the same species. One is a really good guard dog, one is not such a good guard dog. That's
exactly right. And some of this, like you might have a catalog or something that's good for certain tasks, but not good for other tasks. And that's what we tease out with research on these strains, is that one is good for antibiotic-associated diarrhea, but completely useless for depression, or one might be good for antibiotic-associated diarrhea and not good for preventing urinary tract infections, and then we've got that clear example of strains within species that are already out there. So I think that dog analogy is helpful in a couple ways.
Absolutely. It was helpful for me when you presented that. I was like, wow, yeah, I never really have considered that they're all the same species and they are radically different as far as their function. I have a couple Australian cattle dogs, and they're built for a certain function, and they're not good for a certain function. If I want a dog to, if I'm laid out in bed, or I have an elderly person in my house who just needs a companion to sort of lay by their side in an apartment all day, this is a really bad choice of dog for that purpose. Because they need to be out running around all the time.
Yeah, I used to have a red Kelpie, and they're bred to run like 60 kilometers a day or something like that. They're just like little battery cells. They just never run out of energy. So not good for keeping your elderly relative company.
Exactly.
No, but very good for the other tasks. Definitely.
Yes. Yeah, and it might be worth mentioning. So you're the head of research of Probiotic Advisor. This is a company that I learned about through you, and I signed up for, and I have been absolutely amazed by that. I didn't know a tool like this even existed, where I can go in and type in a particular condition, like for example, my 2.5-year-old, since we potty trained her, started suffering from some constipation, and started going, instead of going to the having a bowel movement every day, it became every 2 or 3 days. And so I can look up, probiotics specific to that function, or probiotics specific to hand eczema, or antibiotic use. How do you minimize certain complications when you're on antibiotics? And it brings up the search results of all the specific research on specific strains of probiotics that have actually been shown to be effective in that specific context. So it's an amazing tool that I didn't even know existed until I started taking your course.
Thank you. Yeah, it started off with just some paper documents. Is how that started. Seriously, probably in 2001. I first started teaching. When I started my research process, and I first started teaching, and it's like, okay, I'm going to pull together these resources, and in the end, with 3 different documents, and they had to be 30 pages long or 40 pages long, and it's like, okay, I need to put this into a searchable database rather than have it all on bits of paper in the old way. But I think we now have that capacity to really look at the research, and because the research has built up so much over the last 20 years, that we don't have to guess, we don't have to take the supplier's word for it, which is what many people were doing before. It's like, this company says it's good for this. I'm like, no, don't. Look at the research. And this just makes it easier, because you can do a search of Medline. And I think we should still all be doing that frequently, but this is a tool that just makes things easier. You can just type in that condition, and it brings up the strains, and it tells you what products in Canada or the US or Australia contain those strains, just to, again, make things easier, because that's the added bit on top is like, this is a great strain, this great research study, but where do you get it? And sometimes those bits of information are not easy to come by.
Yeah, absolutely. Okay, so one other thing related to probiotics that I want you to speak to is colonization. I think this is also a widespread myth. People have the assumption they take a certain probiotic and they think it goes in there and it just starts colonizing the intestinal tract, and then starts reproducing. And so now you've got huge quantities of this particular species of bacteria. What is the deal with that? Is there any species that colonizes? I know this is probably something that you could talk about for 5 hours, but how could you sort of simplify into a few minute long answer?
Simplify, generally no. Generally, we don't get colonization from current generation probiotics. So we're talking about lactobacillus strains, bifidobacteria strains, even the E. coli strains we currently have, Saccharomyces probiotics, and I would say the bacillus type strains too. They don't permanently colonize. They're all temporary visitors. And this has been clear for also like 40, 50 years. I think this is, for me, the interesting thing is that there's this conception that one of the 5 R points is re-inoculate, and people think that they can just take antibiotics and then just pop a pill and everything will be replenished from that and forever onwards. And it's good to know that that's not true. It's rubbish. It does not happen, because I think it makes you appreciate and care for that ecosystem differently when you know that it's actually, one, it is unique. It's yours, it's been passed down your family line, and we should respect it as such. And 2, that it's not as simple as that, and it's not reality. If we wipe out our bifidobacteria, we can't replace it with one in a supplement. It doesn't stay, and again, you go back 40, 50 years, it's like a good probiotic strain will last a week or 10 days in there versus ones that just pass straight through or ones that die in the stomach or small intestine. And we've had studies showing this time and time again, is we just don't get long-term colonization as a general rule. There is the odd exception, like there's the odd study. I think there's one using a strain of Bifidobacterium, I think it was AH1206, which isn't commercially available now, but that was able to colonize, I think, in 30% of people for 6 months afterwards. But that is immense rarity, because you can just, if you delve into the literature, you'll find that they last for 5 days, 2 days, 10 days, 14 days, but you can see their populations just diminish. If you take daily stool samples, it goes down all that time. And you can investigate this yourself too. I mean, you can do a stool test whilst you're taking that probiotic, and then 2 weeks later, do that same stool test and keep every other variable the same. And you'll see that maybe the bifidobacteria was here and then it's not there anymore. It's pretty clear. And as someone that's done a lot of stool testing over the couple decades of my practice, using accurate assessment techniques, is you clearly see that they do not colonize in these patients. And I think it really cheapens the thought of the ecosystem and care of the ecosystem if we think it's easily replaced just by popping a probiotic pill, because it's not.
What do you think of, and this is something I don't believe that I've heard you mention in the course. I believe it's Bacillus subtilis, spore-based probiotic that is in products from microbiome labs, and they talk about it like it does colonize, and that it sort of takes up residence there, and also that it has an impact on modifying other species of bacteria that are present in the intestines. What do you think of those claims about that?
I mean, I think
species?
The latter one, we know that probiotics do have some impact on the gut ecosystem. Now, I would put that in general as relatively minor. You compare that to changes in diet. You compare that to prebiotic usage. The alterations we get from a probiotic are relatively small. They're not none often. And that can be bigger. Like if it's right after chemotherapy or right after antibiotics, you're going to get bigger changes from a probiotic usage in that case, because the ecosystem is immensely disrupted, and it's more flexible in terms of how things shift at that point. But if you take someone who's a more stable ecosystem, you give them a probiotic, whether it's spore-based or otherwise, the impact will be relatively small. Not nothing, but relatively small. But if you change their diet markedly, you give them a couple of prebiotics, you'll see dramatic changes in that ecosystem. But in terms of the long-term colonization, I haven't seen research to suggest that that's the case. Now, it's possible that I've missed that study, so I'll, showing that there's long-term colonization. Again, doing lots of stool testing over the years, I can't even recall seeing bacillus showing up on stool tests very commonly at all, whether people are taking that when people are taking that supplement, which makes me, whereas I do see bifidobacteria, I do see lactobacilli, that populations do go up and down if people are taking the supplement versus not. That makes me think those show up on stool tests, whereas I haven't really seen that with bacillus, which makes me less, at least at detectable levels, it seems less likely.
I interviewed 2 gut health experts recently. I won't mention names, but I guess people will find out if they listen to my podcast, because I'll release both of them. One is with a sort of world-renowned gut health researcher and clinician, and then the other one is with a clinician who specializes in gut health, who's also very smart, and I have a lot of respect for. They have very different opinions on probiotics on a very critical issue. The researcher is very strongly of the opinion that strains matter tremendously, and that even within a given species of bacteria, the specific strain determines whether or not you will get an effective outcome. The other gut health expert was arguing the opposite, that kind of all this talk of strains is greatly overblown and is largely sort of marketing hype to drive profits by the creators of these strains. What's your take on that?
I disagree. So I want to clarify, because I think there's a lot of I disagree with the second, is what I'm going to say. Mm-hmm. And I'll tell you why. Because if you pick up a lot of probiotics on the market, like it might say Lactobacillus acidophilus, Bifidobacterium brevis, It'll have the genus and the species name, nothing else. What that tells you is they're using a generic line of bacteria that has never been tested, has never been studied. We don't know if there's any clinical effect from these. We just know based on extrapolation, but we don't know for sure. When you're looking at a probiotic and it's got the first name, last name, so genus, species, and then it's got a code after that name, that's the substrain. Anything with a code, the only way it can have that code is because it's a strain that has been clinically studied in a research study, and it's been shown to have some sort of effect. Maybe it's immunomodulates, maybe it stimulates peristalsis, maybe it helps with constipation, maybe it helps lower inflammatory markers. So I think, personally, I think it's very important to look at that because, and especially, I think this is one of the biggest areas where consumers are completely misinformed because you don't know if you're picking up a probiotic by any. I was just showing a patient that who was taking a probiotic, and I had her, let's look at the label. Let's look at it together. Let's see what's on this label. It just had generic strains. Like, I don't know if any of these strains have been proven to do anything. And I think it's really important if you care about what you're putting into your body, and especially when it comes to probiotic strains. And I think eventually probiotics are going to be very specific. I mean, we have companies that are studying probiotics that can help with anxiety, that can reverse eczema, that can help with depression. And that you can't say that every lactobacillus acidophilus is going to do that when it wasn't that strain that wasn't studied. So I think that's really important. I think the other piece of confusion on probiotics is what the expiration date on the bottle means. And it can mean different things depending on different companies. I think people don't understand this. Like, if you're picking up a bottle of a probiotic and it says 100 billion on it, or 30 billion, whatever it is, there's something called, if the company really values what it's doing, there's something called overage. What that means is that when that probiotic is manufactured, and usually at the point of manufacturing, it has 2 years to expiration, 18 months to 24 months. In order to get to that, they have to put overage in the capsule. So if it's 100 billion, they might put 130, 150 billion, because it's going to slowly degrade over time. And that expiration date doesn't mean the probiotic has expired. It just means that on the date of that expiration, we can still guarantee that there are 100 billion CFUs in one capsule. That's what it means. And I think a lot of people get confused about this because they think that expiration dates are the same. They're not the same for everything. And when probiotics, it's really more like guaranteed till date. And depending on the manufacturer, they're really, they're doing third-party testing to see if there are still viable probiotics, because there should still be 100 billion or 30 billion, whatever the bottle is saying, there should be that much or more on the expiration date.